there. Well, coming back to our main topic of today, if you're just joining us, it's quite a serious topic as well, and of course, for a lot of parents out there, it's something that you need to be prepared about, and you can never be prepared about something like this. And I just found out that 15 to 20% of births in Malaysia end up sometimes in premature or preterm birth, and of course, it's something that can be worrying for parents out there. But to enlighten us, to talk more about this, let's please welcome our doctor in the house. We have Dr. Salehuddin Samsudin. He's a consultant pediatric neonatologist.
That's right.
Of Salehuddin Darby Medical Center, Parkcity. Well, I hope I said that right, because it's quite a mouthful.
It is.
Right? So, today's topic is quite an interesting one. Even for myself, I'm just learning about it. I know about premature birth, but what is the actual term of pregnancy? Because we know in general that people always say 9 months, but what's the actual term in weeks?
That's right, yeah. In terms of weeks, most pregnancies, or I'd say the average pregnancy, is up to 40 weeks, and
40
we call
weeks.
it term.
Okay.
However, if you give birth at 3 weeks before your due date, so at 37 weeks or less, that is what we classify as a premature birth. Now, there are different types of premature births, and not all premature babies are the same. We tend to stratify those groups into 3 groups, and you may have a very so moderately premature infant. So that's from about 32, 33 weeks until
So that's moderately
weeks.
premature.
That's right, yeah. You have a category below that, which is from 28 weeks to 32 weeks, and that is very premature. And even less than that, we have the extremely premature baby. And these would sort of be babies from less than 28 weeks. And at the moment, what we call the threshold viability, that's the limit where babies are able to survive, is around about 24 weeks.
24 weeks, which is how many months?
Which is about, about 3-4 months before baby is born. And we've had babies surviving from 22 weeks onwards. And, it's a very exciting field for me, and I suppose a lot of doctors out there, and for myself, who actually especially train in dealing with premature infants, we're seeing a great degree of improvement in the outcome, and also in the ways that these babies are treated, and it's actually a very exciting field.
Well, it's interesting that you say it's an exciting field, because obviously for the parent, it's not exciting for them at that moment in time. But enlighten us why you call it exciting, because like you said, there's a development in this field where the babies can actually live a long, healthy life after.
That's right. I mean, we're seeing, number one, we're seeing more and more babies survive who we didn't think would be able to survive before. And this is partly to do with the advances in technology, but also it's also in the way that we've been made aware of how to actually simply care for these babies. And another way why it's exciting to me is because some of the complications that we have in these premature babies, we know that we can actually treat better and avoid. So I'm hoping in the future we'll see continuous improvement in this. But obviously, as you say, it's a very worrying time for the parents.
But at the same time, you saying all this gives hope to parents, knowing that technology with the advances, and of course, doctors like you in the field who are so passionate about helping aid these babies, I think a comforting thing for parents out there. And a lot of parents to at least prepare them, that at least if something like this happens, they are in good hands. But what can you tell us, what causes premature or preterm birth actually?
Well, when something goes wrong in pregnancy, and it can happen to anyone, I think sometimes the finger of blame points to, the mother. And I think it's very unfortunate. There are many causes of prematurity, and actually in up to about 30%, we don't actually know. But we know that there are things that we can do to actually reduce the chances of actually having a premature baby. And first of all, it starts even before you're pregnant. If you're planning a baby, then first and foremost, live a healthy lifestyle. So what I mean by that is, first and foremost, if you're drinking, if you're taking drugs, if you're smoking, then stop.
Of course,
and those are known risk factors for having either premature delivery or actually having stillbirth, etc. And the minute that you know you're pregnant, well, first of all, congratulate yourself.
Yes.
And then rush off to see your obstetrician and gynecologist. And get an early checkup, make sure that the doctor picks up everything's okay. If there are problems, then they could pick it up early and deal with it early before it becomes a problem. The next thing you can do is actually look after your health in terms of what you eat. So try avoiding eating raw and uncooked meats,
I see.
fish.
even the sashimis and stuff, we shouldn't be...
Try to avoid that. That's
it.
right, yeah, because there are, we know that there are bacterial infections in those kind of environments which can actually cause problems in the baby inside you, and you actually have to make sure that you keep your hygiene up to scratch, and things like urine infections and sort of vaginal infections in women are fairly common. But if you're pregnant, then it could be something that would lead to premature birth.
So always make sure you know of your body and what's happening and taking care of it. Well, just like myself, if you have a question out there and you want to ask our doctor, you can actually call us. Our lines are actually open now at 0355690349. If you're a parent or parent-to-be and you've had any inquiries, you can actually talk to our doctor right now on our show. Right. So, like you were mentioning, to take care of our health, like you said, sometimes they always put the blame on the mum. Of course, if she's doing all those things that you said she shouldn't, then yes, maybe the blame can go on. But what about those cases that you just don't know why it happens? Because the mum is being healthy, she does her exercise and eating right. Why? Can you say what are the causes then? Is it unknown
it's very difficult. I mean, in a lot of situations, it just happens that the mother goes into spontaneous labor before it's due. And there are times that we can actually identify what the cause is, but there are times that we just don't, and you just have to break the news to the mother and prepare for the worst, but hoping for the best. And I think these are times when it's actually important to actually, for me as a neonatologist, to actually get involved and speak to mother and father, of course, and try to actually explain to them what's going on and what the possibilities. So, you know, it's useful for us to actually intervene earlier on.
So you can detect if the child is going to be premature? Is that?
Yes, I mean, in some situations you can. It's not always reliable. There are signs of early labor which women may be able to pick up. But sometimes a baby may need to be delivered prematurely because of maternal problems. So she may not actually be in labor.
So it's induced?
It is induced, or if it's an emergency, for instance, then it could be delivered by cesarean section.
And what are the survival chances? Because you were telling me earlier, obviously there's the moderate, and of course, what are the chances for the different categories of the premature, and how should parents prepare themselves for this?
When you're from 32, 33 week onwards, up to 37 weeks, just before 37 weeks, your chance of survival is very good. We don't expect any huge problems in those babies. Some of them may have very minor complications. First of all, the breathing may be a little bit laboured, etc. The feeding may be a bit slow. But in terms of long-term outcome, we largely expect those babies to do well in terms of survival, and also in terms of the development thereafter.
Because of the lungs, the heart, and
lungs,
everything,
heart, the brain's more mature as well, and it's more able to cope with being on the outside. But when you're between 28 to 32 weeks, then your risk is higher. You're still more likely to survive, and when you survive, say, sort of, 80% chance of survival plus, maybe higher than that. But you have more problems with your lungs. So you may have problems like chronic lung disease, where you require oxygen for a long time. You may have developmental problems because your brain is still a little bit fragile, and your feeding will be taking a bit longer to develop. But those are the main things. But when you go on to the much earlier babies, I'm talking
like 4 or 5 months
24,
before.
exactly, 3 or 4 months before.
3 or 4 months,
Yeah, so around 24 weeks, 28 weeks, that sort of number. Then it becomes very difficult. Even within that category, every week counts.
Of course.
If you're, let's say, if you're sort of 24 weeks, then your chance of survival at best is around about 50%.
50%?
50%. And that is survival. And when we talk survival without any long-term disability, it's actually even less. And there are those who actually survive even younger than that. 22, 23 weeks is not unknown. I mean, I've had a 22-weeker who's only about 500 grams who survived without.
And how long are they actually? Because they have to be hospitalized for a certain...
That's right. They have to be hospitalized for a long time. And majority of the time we tell parents, look, your baby is actually probably going to be with us in hospital until its due date, more or less. Some babies, if they have more problems, that could be longer than that. Some actually might do really well actually earlier than that. But that's, more or less what we say. And, the problem is it's very, very difficult to tell from the offset. And every day, as every day comes, every week comes, and we may be able to give them a bit more of an assurance whether things are going the right way or not.
That's right. Yeah. But it must be hard. I mean, but you must have a very good skills in comforting parents as well, because you've handled a lot. How long have you been taking care of premature babies?
Gosh, I've been doing pediatrics since just after graduation in
Seriously?
2000.
Was it always a passion for you?
Yeah, I've always loved dealing with premature babies in the sense that I think it's, although it's very emotionally and it's technically very challenging, I think the dividends that you get from the satisfaction of actually seeing one come out fine is actually beyond words, really. And I still have a lot of thankful parents who actually still remain in touch with me. And it's nice to see them come back after being discharged, and a lot of them still come back on a yearly basis on their birthday, for instance, and they bring in little cakes for us, so it's really wonderful.
And you've seen some of the kids grow up, I'm sure, as well.
That's right.
Well, we actually have a caller on the line. Hi.
Oh my. Hi, hello, yes. Good morning.
Good morning, how are you? Gomati?
Good, thank you, yeah.
Hi, do you have a, I mean, I'm sure you're calling because you have a question or you want to share something with us, with our doctor?
Okay, actually I have a colleague who is currently pregnant, and she is having a complication whereby the doctor that she is seeing is mentioning to her that the baby's lung is not, one of the baby's lung is not expanding. I'm not sure whether I could get any advice, but just want to share that it seems that if the baby lungs doesn't expand, the baby could die in the womb, or it could die when the baby was delivered. So I'm not sure how, what is the percentage of the baby to be alive when the baby is born. So is there anything that I can get from the doctor so that I can advise my colleague? She's currently working at apparently good.
Okay, just a second, go with Dr. Saleh, do you have anything you want to ask her before you can answer her question? Is there any other details you need?
No, that's fine. I'll try to sort of,
Thank you, Gomati, for calling.
Thank you very much.
Will answer your question.
Have a good day.
All right.
Thank you very much.
Yeah. Based on what she's told you.
Right,
Thank you for calling.
I think it's a very interesting scenario that we've got here, actually, where we have one or both lungs actually not expanding very well. It could be due to a number of things, and obviously the lungs are the most important organs in terms of survival. When baby comes out, first thing one knows actually good, whether it's got a good pair of lungs. And in some ways, if if baby is actually born in good condition and the lungs are actually developed enough for us to be able to sustain the baby to survive in the ventilator, then there is there's a chance that the baby's lungs may still grow afterwards, but it depends on what actually causing the problem. If the baby needs to be delivered early because there are complications, then obviously you have, on top of the existing lung problem that's developing poorly, they also have the problems of having premature lungs. So, it's a very difficult scenario. I think it's very difficult to put a number, what percentage of survival, etc. It depends very much on each case. There are no studies that can actually give you, what is the number for your child, and I think what's right is actually try to get the information as much as you can from your doctor. But if you believe that you need a second opinion, then please do so.
Yeah. So you believe, obviously, it's better to go for a second opinion in
I think
case
if
you're
you
not
have doubts about it, then it may be best getting a second opinion. But very often the second opinion is actually just the same as the first one.
Yeah. But for peace of mind,
exactly.
If they want
if you want peace of mind, I think it may be better you get a second opinion. But it is very difficult to say without having all the facts.
Of course. Thank you so much, Doctor, for answering the question. And of course, we'll be going for a very short break where we will still have Dr. Saleh with us. We'll be talking to a daddy who has actually his wife has just given birth to a premature baby, and we'll find out more about him. And we'll have Doctor joining us later after that. So don't go anywhere. We'll be right back after this break. Welcome back to Bella Society. If you're just joining us, we're continuing our conversation about premature babies, and as you just saw just now a flash on a celebrity, international celebrities with their kids who were premature. As you can see, they're healthy babies, mummies are all happy, the parents are all happy. But of course, premature birth or preterm birth can be something very worrying for parents out there, especially, that whole first day coming home, the homecoming of your baby can be overshadowed by worry and grief because your baby obviously was not born at the full term. term that they were expected to be born. But at the end of the day, I was talking to Dr. Saleh earlier, and there's big progress with babies just getting much, much better. And of course, we have a daddy on our show who's very bravely come on our show. We have Mr. Tan Po Chong. He's a new daddy. Congratulations, first of all.
Thank you.
Thank you so much for coming on to Bella. And you were listening on to Dr. Saleh earlier as well, right? And tell me a bit about your experience. Your wife, what's your wife's name?
Theo.
Theo.
Sharon.
Sharon, So how is Sharon now? I heard her premature birth was 25 weeks.
Yes.
And according to Dr. Saleh, that's considered the extreme, am I right? Extreme premature. And tell me a bit about that experience. How did you feel at that time? And then 如果我講廣東話都可以。
廣東話都得啊。
可以。
會好緊張啦，好緊張，然之後好驚，因為好擔心個 BB 會點樣，同埋媽媽佢會唔會有咩問題啊嗰啲啦，會好驚啦。
Yeah. So obviously your feeling is fear. They're not sure how the mother feels, but at the same time, because you want your wife to be okay, but you want your baby to be okay. So many emotions, right? And when the doctor told you 25 weeks is extreme, right? Because born very, very early. How did you feel like to cope with that situation that your baby will have to be in hospital for how many months?
Around 3 months.
3 months, How did that feel at that time?
都係好擔心啦，但係多數都好擔心啦。因為個仔好細，佢唔知道將來會點樣樣，同埋媽媽係咧就佢好緊張。因為第一個仔，所以佢經常會流眼水，會喊，要多啲鼓勵佢啦。
So what Tan is actually saying for those of you at home who don't understand Cantonese, obviously the time was very worrying for them, and of course for the mother herself. I mean, being a mommy, she had tears, she cried, but at the same time wanted to, take care of the situation. And then for you as a daddy, how do you become strong? Because later you. You used the word strong, how was it for you?
I think positive.
Think positive.
即係會多啲鼓勵啦，鼓勵自己嘅老婆，因為我係一家之主啊嘛。如果我都唔企起身，我都唔振作起嚟嘅話，即係講老婆啊，都唔要加油啊，一路加油啦。
So a fantastic husband. Obviously, they always say behind a successful man is a woman, but in this case, for him, he had to stand up as a husband, as a man, so that the wife can continue being strong as well. Because imagine both the harm, both the hokanan, hamai. It would be hard if both were crying at the same time. Sorry, my Cantonese is all over the place, but I'm trying my best right here. But and at that moment, you're a new father. Obviously, being a new father and parent is something very daunting on its own. As in. So it's hard now that you have a baby that's premature. Did you ask the doctor a lot of questions? 好多嘢愛問 doctor 啱冇 ？Because baby 係 premature， 有你成日問 doctor 嘢冇？嗰次
有啊，會問佢咯，即係講baby 啊咁嘅情形，我哋應該要點樣去照顧？
點樣照顧？
因為佢有時會忘記呼吸啊。
忘記呼吸係咩啊？
即係佢有時會逐親啦，食奶嘅時候會逐親，然之後有問 doctor 應該要做啲咩嘢啦。因為 doctor 唔係一路企喺你身邊啊嘛。啱。所以有時要有多少咁嘅知識咯。
And 而家你嘅老婆 Sharon still in the hospital 係咪
？Still in the hospital.
So now we're having like half English, half Chinese conversation 啦。你都明白係咪 ？Still in the hospital. Your wife hospital or baby only 去得入邊
？Wife 同 baby 都係
hospital 啦。
Now wife 喺 hospital 係 take care 個 baby，because
學下點樣 take care 係咪？
啱。
So the wife obviously is at the hospital at the same time to learn how to take care of her baby that's premature. Because first baby already 好驚係咪 ？Isn't it? I can imagine my husband is scared to even hold babies that are few months. What more a premature baby？ 好細粒係咪？好細粒係咪？好得意。咩名？你嘅son叫佢咩名？
陳恩澤。
陳恩澤，
陳恩澤，
陳恩澤，冇相我，冇攞到相今日，冇啊。And 你個 family 咧 members 要好 supportive 冇？I think you got that part. Your family members supportive to the whole situation.
我 family 都好好啊，佢哋會去
pray for me， 跟住佢周圍都去拜神啦，祈福啦咁樣好多謝佢哋。
So needed feel more comforted with that 啦，啱冇 ？So baby 要翻嚟幾時 ？When is your baby coming home？
應該係星期四啊。
星期四係咩？Thursday，this Thursday， 好 happy 咯。So thank God everything is okay. 25 weeks, which is extreme, but everything worked out well because of the good hands of the doctors. And of course, mommy and daddy very strong as well. So we're going for another short break. We'll still have Tan with us, but don't go anywhere. This is what we have when we come back. Welcome back to Bella Society. If you're just joining us, we've been talking about premature birth, preterm birth, and of course, things, the complications, what parents go through. And as you just saw just now, some foods to avoid during pregnancy. And we'll still continue our conversation with Dr. Saleh and Mr. Tan. Just a quick one. Smoked fish, no caffeine, are those big no-nos during pregnancy and can it cause premature birth?
I wouldn't say it's a big no-no for caffeine. I mean, certainly it can increase your sort of tendency for having gastritis.
I see, yes.
Caffeine is not really known as something that would actually stimulate premature labor, but it's probably best to avoid if you're sort of prone to that sort of thing. Smoked fish, I suppose it goes for sort of partially cooked and uncooked fish meats because there are some bacterial organisms which can actually cause problems to the unborn baby and of course to yourself as well. So it's best to avoid those things, especially when you're pregnant.
Very interesting, and of course a lot of you at home as well as myself who are wondering what I can or cannot eat when I'm pregnant, do give us a call. And of course if you want to find out more about premature birth and how you can actually handle the situation, call us at 0355690349. The number's on our bottom screen right now. We'll continue our conversation. Obviously, Tan's story is very motivating one to know that the baby is doing very well, coming home on Thursday. So tell me a bit about, because you said 25 weeks, or you were saying maybe it was slightly earlier?
Yeah, I think looking at the baby, it could have been even earlier. I mean, the dates that we got based on the scans, you can imagine it can be a little bit out. But when the baby came out, it's about 740 grams, I think, somewhere thereabouts.
740
so it's quite small.
grams.
But actually saying that for a 25-week baby, 24-week baby, 740 grams is actually quite a good size.
Really?
Yeah. And because they tend to be about 500-600 grams, so that's actually quite a good size for a baby that age. The skin was almost gelatinous, you could almost see through the skin, and the eyes were still fused. So, looking at the baby, I thought this could be even younger. But I think the baby came out in really good condition, and I did warn the parents, like, we don't know what's going to happen if he becomes
What was some of the advice that you gave Tan at that moment, and how did he handle it? Obviously, like I said, it's daunting being a parent holding just a newborn baby because you're so worried about the head, they're so fragile. How did both of them, or especially Tan being the dad, seeing the baby being born?
I think he was overjoyed. I think he was really smiling ear to ear. Very happy.
He's a very happy, smiley daddy right there. I'm so glad that the baby is okay and everything.
But I think he had difficulties. I think most parents, when a premature baby comes out, especially somebody that premature, they often have difficulty identifying that's actually a baby.
Of course.
Because it looks red and the skin's very fragile, etc. And it's just very tiny.
Of course.
So it looks very, very frail and not what you would expect a picture of a baby would be. And a lot of parents actually, although they're grateful that babies come out fine so far, but they feel the fear of actually touching the baby, actually having to, be able, they're not sure what to do.
And plus the baby's in an incubator, so you don't know whether you're supposed to, you don't want to pass germs and stuff. Well, we actually have a call on the line. We have Kate on the line. Hi, Kate.
Hi, Veronica.
Hi, how are you? Hi. So any questions for our doctor?
Yeah, I just have a question, like, because I'm not experienced in this, but I just want to know, like, what are the extra care and protection one should take note on? Like, if I have a colleague of a premature baby, how should one carry the small, tiny baby because it's fragile? And another one will be, which one is better, breastfeeding or bottle feeding?
Breastfeeding or bottle feeding, and how do you actually carry baby? Okay, Kate, is that all, Kate?
Okay.
Is that the questions? All right. Thank you, Kate, for calling.
Thank you.
So those are some of the questions. But at the same time, premature after you take it home or premature in the hospital? Different way of handling, right? So maybe you can enlighten us on that.
Of course, in terms of handling, first of all, it depends on level of prematurity and how old the baby is. If baby is actually born, just freshly born, extremely premature, then you wouldn't be able to handle it much because it will be in an incubator.
Correct.
And but once the baby is actually well enough to come out incubator, or actually sometimes in between while doing cares, you're able to handle the baby and just hold the baby. Usually one hand is all that you need because the baby is very, very light.
Really, one hand.
And you actually have to be very careful and changing the diapers, etc. And but once the baby is actually a bit stronger, it's more than 1 kilogram, then you can actually basically handle it just like a normal baby. The other thing is, when babies are born that premature, the skin easily comes off. So we don't even sort of dry them with towels. We actually just put them in a plastic bag or cling film, and that just protects the skin, protects the moisture, prevents any heat loss, and that's been shown to actually, give the baby the best environment immediately after it's born. So, your question depends on exactly how old the baby is and how premature.
Breast, and she was asking breast.
The second part was about breastfeeding or bottle feeding. I think, every pediatrician will tell you exactly the same as I do, breastfeeding is the best. And that's not just for term infants, but also in preterm babies especially.
Because of all the antibodies and the nutrients.
That's right. You were saying the antibodies and nutrients that mother passes on, that cannot be synthesized in lab. Nobody can make that.
True.
So the mother can feel quite positive that she's actually contributing towards the baby's health. And the other thing is, when you first establish feeding in premature babies, you've got to be very careful how you feed them. And you have to feed them usually very, very small quantities of milk. And we always say, if you can give breast milk, so expressive breast milk, and we'll give maybe...
Explain express, because some people might not know what express breast milk means.
You actually pump your milk out, and then you store it, and when it's ready, we give a little bit to the baby. And we may give as small as half a ml initially every few hours, and gradually build up. And the breast milk, apart from actually giving you the protection and nutrition, it's actually the best milk that baby's tummy will tolerate, because we
it's
know
natural.
It is natural. It's exactly as you say. But we know that some babies who actually have no choice, then we can give them formula milk, which is designed especially for premature infants. But it can never be as good or as tolerable to the baby as actually having breast milk.
Breast milk. Tan, did your wife express her milk for your baby?
Yeah.
Yeah?
Yeah. I think we talked about that from the very beginning, didn't we? Yeah.
How did you feel, obviously, when Dr. Saleh was telling me, like, when the baby is being wrapped in cling film and plastic, it's not something normal that you would see. How did you feel? Were you confident with seeing your baby handled that way, or did you feel like, what are they doing to my baby? Because I'm sure it's quite a daunting experience. How did you feel at that moment in time? Did you ask the doctor a lot of questions?
I don't ask doctor a lot of questions.
No, you didn't?
I think I need to prompt him to...
Just pray God healthy is okay.
At that time. So any questions you want to ask now? Although obviously baby's coming home soon and all that, any questions you would like to ask doctor on how you actually take care of your baby?
Now I'm blank at that.
We can talk again after this.
Yeah. They'll talk privately. He'll ask all the questions later. After the show, I'll be seeing them both having a long chat over there. But, how, in terms of parents, when they prepare the day to take home their baby, emotionally, how prepared must they be when knowing that the baby went through all that, especially like you say, the extreme, like you say, when it's the moderate, they're born like a few weeks before, it's not as severe. But when they were born, like especially Tan's baby, when they bring them home, what are some of the things they have to look out for or be prepared for?
Yeah, that's right. It's a very daunting process, actually bringing your baby from the safe environment in the hospital to actually being home. And I think number one is feeding. How am I will I be able to cope feeding my baby at home? And we tend to actually allow mothers to actually practice before they go home.
So what, you mean proper breastfeeding?
Well, some of them breastfeeding properly, some of them bottle feeding, etc. And a very small number actually still need some tube feeding when they go home. And what happens if the baby goes dusky, or something happens, baby's breathing is a bit slow or erratic, what do I do? So these are some things we'll have to teach them. How do you cope with the situation?
Not to panic, right?
Exactly, not to panic. What do you calmly do, etc. And what to avoid really. And in general, when they're ready to go home, you know, they should be more or less cared for in the same way as you would do in a baby who's born at term.
Because they've already been taken care of to the time where they're healthy. Well, we actually have another caller on the line. Hi, Raymond.
Hi, I'm Raymond from Taipei. This is my first time to watching Bella. I'm very happy. Okay, I want to ask the doctor about this is my neighbor problem. He asking about if the baby is too small, but the doctor gives the medicine is too high. Okay, so then I want to ask him how can we learning about the medicine? Because the baby too small, it's just very few months only.
Okay.
But the doctor gives the medicine until he say about 1 year like that.
What happened to the baby? What medicine was he giving the baby? Was the baby sick or?
The baby is sick, yes, correct.
Okay, and the baby is a few months old.
Yes, correct. He's just 3 months only.
Okay.
But the doctor gives him until 1 year old like that.
1 year old sort of dosage will.
So
maybe doctor, you can ask him some more questions.
So you're saying that the baby was given the dosage of a child who's older, or was it given until the child is 1 year old? What's, you know?
He say the problem is just don't know what has happened, but the doctor gives him until 1 year old like that. He say very scared. So that he changed to another hospital to checking the baby. So that when
the medicine is for the baby till he reach 1 year old, or the medicine is suitable for 1 year old baby? Which
you say just give him a few months only like that, just a few months. But the doctor give him until 1 year old, 1 year like that.
Oh, so he's given him for until 1 year old. Okay, yes, thank you so much, Raymond, for that. Dr. Saleh will try his best to answer based on whatever information that's quite a interesting, complicated situation. What should he do in this situation?
It is, but I mean, it depends what the medication is and what's the actually situation, what's the reasoning behind it. There are lots of medications that we give in children that aren't actually licensed or actually aren't designed especially for children. And that's because it's very complicated to actually go through the whole process of actually getting that sorted. But we know it's safe and we know that it's effective, and we know that some children need prolonged treatment. Commonly, I'm giving an example of preterm infant. They often need some multivitamins to supplement their nutrition, and if you're born premature, you may need that for 6 months up to a year, depending on the child. And we try to adjust and cater to the child's individual needs by looking at the dosage according to the child's weight. So even if it's given for a prolonged period of time, I'm sure there's a good reason behind it. And I'm sure that the weight is actually taken into account. I'm sure that this is probably not a huge problem. But let's just say if the doctor mistakenly given a dose which is too high.
That's what I mean. I wasn't quite sure whether it was a wrong dose or.
Yeah, that also depends, because when the medication is actually prescribed for children, there's actually a sort of a reasonable safety buffer. Okay, so you may, although it's, for instance, a paracetamol, for instance, you give babies about 10 milligrams, 15 milligrams per kilo. Babies can take up to about 4 or 5 times that much without any problems. So there's actually a reasonable sort of buffer, this bit of gap that there is, that's safe for the child, even if it's over the dose.
Over the dose.
So it should be okay. There are only very few drugs that actually got very what we call narrow therapeutic window. So sort of within that very strict doses, it's fine, and outside that is not. But most drugs, there's actually quite a good sort of wide range that they can actually tolerate without any problems, even in babies.
And just give us one last word on what family members in this situation like this can do for their loved ones who are going through this time as well.
I think first and foremost, you've got to be open-minded, you've got to be supportive, but don't be afraid to ask questions, because many people actually, they just blank at the time, they don't know what to ask, and if you don't have any questions at the time, write it down and speak to your doctor again later. Because what's worse, is actually you don't know what's going on with your child, you know, and we can sometimes easily assume that, you know, they don't ask any questions.
Yeah.
They
think
must
they
know what's going on.
They know what's going on. Yeah.
But actually, it may not be the case. Maybe that they have no clue. They don't even have enough information to ask the questions. So please ask and
don't
just
be shy,
supportive.
right?
Don't be
Just
shy.
ask.
Don't be shy. Just ask, and we'll be you know, we'll be completely honest with you. If the child's doing fine, that'd be great. If the child's not doing fine, then, you know, you are the most important person in the world who needs to know about that.
And knowledge is power, as they say. But at the end of this case, you will be able to tend to your baby. And Tan, anything you want to say at the end before we wrap and say goodbye?
I think no.
No, but anyway, congratulations again on your newborn baby, and I hope to wish you many more babies to come your way as well. Thank you so much, Dr. Saleh, for enlightening us about this. I've learned a lot myself as well. Thank you so much for coming on to Bella. Well, we'll be going for, well, basically, we're wrapping our show right now. Do catch us tomorrow for Bella Mas with my love.